Do you continue to suffer from low thyroid symptoms despite thyroid hormones and normal test results? Symptoms like gaining weight with low-calorie diets, always fatigue, the inability to lose weight with intense or sustained exercise, depression, constipation, you're overly sensitive to cold weather, there's poor circulation, muscle cramps while at rest, there's morning headaches that wear off as the day progresses, you're catching colds and infections easily with much difficulty recovering. You have dry or brittle hair, your hair falls out easily, sometimes in clumps. You have dry skin, you have low axillary temperature, edema around the face, or the loss of the outside portion of your eyebrows. If you're reading this report, then there's a good chance that you or a loved one has been struggling with a low-functioning thyroid, or you suspect and feel that you must have a thyroid problem even though your doctor tells you that there's nothing wrong. You're likely one of many women suffering from hypothyroidism or the many symptoms of low thyroid or even Hashimoto's thyroiditis. In my opinion, from what I've seen, you have quite possibly been misdiagnosed, or at the very least you have not been given a complete diagnosis. And this can be very dangerous. Many women, maybe even you, lay awake at night wondering why they are having so much difficulty losing weight, always suspecting and feeling that something was being missed with their thyroid, thinking to themselves, why else would I literally have every thyroid symptom if my thyroid was normal? Wondering how it could be possible now that I'm on thyroid hormones and my labs are now normal. How could it be possible that I still have all the same low thyroid symptoms? The bad news, you're right to wonder. You also have every right to be frustrated because it is my experience that many thyroid disorders are either missed, they're incompletely diagnosed, or flat out misdiagnosed. So imagine how life would be if you could finally lose weight. Imagine how life would be if you could stop losing your hair. Imagine how life would be if you no longer had debilitating fatigue. Imagine if you were no longer depressed and or anxious. Imagine what life would be like without constipation. Imagine what life would be like if you could finally find the answers and direction you needed to recover your health and your life. Hi, my name is Dr. Josh Bletzinger. I build individualized and customized functional medicine programs that will show you how to reboot your thyroid and recondition your metabolism. In the presence of an autoimmune condition, I build an individualized and customized functional medicine program to help arrest the immune surges against healthy tissues that will also help you reboot your thyroid and recondition your metabolism. But my first question is this: what's in store for you down the road if your thyroid symptoms persist? I know just how frustrating hypothyroidism can be for women. I see patients suffering from this condition virtually every day in my office. And because of this, I know how the symptoms of low thyroid can destroy a person's quality of life and health. I also know that so many women out there are missing an extremely important piece of the puzzle. So missing thyroid problems are very common. So allow me, without getting too technical, to explain how this happens. First of all, you must run the proper tests in order to make an accurate and complete diagnosis. Proper testing that looks at every metabolic body system. This is where many healthcare providers fail. By and large, many healthcare providers only run one thyroid marker, TSH. If TSH is elevated, then and only then do they make a diagnosis of primary hypothyroidism. This is commonly when thyroid hormones are prescribed. I go about the business of determining what your condition is driven by: Hashimoto's thyroiditis, or true hypothyroidism, or maybe even something else. And this is the cornerstone of a successful outcome. A correct diagnosis. It is imperative to identify all the triggers creating hypothyroidism. And I'll tell you what, each person will have different and unique triggers. And when the time is taken to find all the triggers, we treat all the triggers at the same time. It is a big undertaking. It's a lot of work, but it's worth it because it works. The days of just being tested with TSH and thyroid hormone have come to an end. The first step before anything else is to find out why you continue to suffer from low thyroid hormones despite normal labs. Then and only then can we go about creating the correct and comprehensive treatment plan to finally reboot your thyroid and recondition your metabolism. The cold, hard truth is this: without a comprehensive diagnosis, you will never find the causative factors to your ongoing symptoms. Without a comprehensive diagnosis, you will continue to be treated with thyroid medications, a pill for every ill, the fad diets, and excessive exercise. Without the proper treatment strategy, you will continue to guess on the foods you need to eat, the supplements that you need to take, the activities you implement, and the lifestyle to lead. It's time to put you in the driver's seat of your health. So schedule that first 15-minute strategy call. It's free. And on this call, we're going to do this. We're going to discuss your problems and I'll answer all your questions. We'll do a complete thyroid qualification case history and questionnaire to help determine if I can help you. You'll find out if you're doing everything possible for your low thyroid or thyroid challenge. And we'll walk you through the answers to your questions with directions on what to do next. So go ahead and schedule that call and finally make those thyroid woes a thing of the past. I'll talk to you soon.